Hi, my name is Mackenzie. I'm going to be your nurse today. Can you state your name and date of birth for me?
Brady Nolan, 3/27/2000.
Okay, perfect. And today I'm going to be performing a comprehensive head-to-toe assessment. So that means I'm just going to inspect and everything from your head to your toes. And to start off, do you have any pain anywhere right now?
No.
No? Okay, and throughout the assessment, if you have any pain, discomfort, or any questions, just stop and let me know.
Okay.
Okay? And before we start, I'm going to draw the curtain for privacy and perform hand hygiene. Okay. And to start, I'm just going to inspect your face for symmetry, any masses, lesions. So your eyes, eyebrows, ears look symmetrical. Your eyebrows and eyelashes are distributed evenly. All facial features are present and symmetrical. And now I'm going to move on to your head. And on inspection, it looks like there's no masses or lesions. And now I'm going to palpate for any tenderness and just let me know if you feel any pain. And your head, is there any pain?
No.
Okay, and your head feels symmetrical on both sides. It's appropriate size for your body, and there's no masses, lesions, or tenderness.
Okay.
And now I'm going to test your cranial nerve number 7, and I'm just going to have you close your eyes and tell me if you can feel something across your forehead.
Yes.
Yes? Okay. Perfect. And after that's cranial nerve number 5. Now number 7, I'm going to have you close your eyes really tight. Okay, open up. Can you clench your teeth, smile, and puff out your teeth? Perfect. That is cranial number 7. That is intact.
Okay.
And now I'm going to move on to your nose. I'm just going to palpate it to make sure there's no tenderness, masses. Okay, and that is midline. And I would test your cranial nerve number 1 by having you occlude one nostril and I would stick something in your nose. You'd smell it, tell me the smell, and reverse for the other side. But because we're wearing the mask and we can't take them off because of COVID, we're going to not test that.
Okay.
But if you could smell it, then your nerve would be intact.
Okay.
Okay. And now I'm going to inspect your eyes. And they look symmetrical upon inspection. And I'm going to don some gloves and I'm going to pull your eyes down. And I'm going to look at your conjunctiva, your sclera, and your cornea. Okay? Gloves. Okay, and if I can just have you look straight. Okay, and your conjunctiva is pink, your sclera is white, and your cornea is clear, which is appropriate.
Okay.
And at this time, I'm going to assess cranial nerves 2, 3, and 4. And I'm just going to shine my pen light in your eyes, make sure that your pupils are round, reactive, and accommodating, and equal to each other.
Okay.
So I'm just gonna have you look straight. Okay, perfect. Your eyes are round, reactive, and accommodating.
Okay.
I'm just gonna have you follow this inwards. Perfect. And now I'm going to assess your cranial nerve number 6, which is using your 6 cardinal fields of gaze. So I'm just gonna have you follow this with your eyes and don't move your head, okay?
Okay.
Okay, perfect. Cranial number 6 is intact. And now I'm going to look in your eyes to see if it has your red reflex, which I'm just going to shine a light in your eyes with the ophthalmoscope, and the light is going to go in your eye and I should be able to see a red reflection.
Okay.
Okay, and the 7. Perfect. There's a red light, so the red light reflex is intact. And now I'm going to assess your glands. So this is your preauricle, postauricle, occipital, superficial cervical. This was occipital, superficial cervical, posterior cervical, deep cervical chain down to your supraclavicle, and tonsillar, submandibular, and submental, which is good. And I'm just checking that they're soft, movable, and they're non-tender.
Okay.
And if they were tender, it would just mean that you were previously sick or had allergies.
Okay.
And you had no pain upon that?
No.
No, perfect. Okay. And then I would assess your mouth
Okay.
by palpating your lips, making sure that there's no masses or anything. But because you have a mask on, I can't do that, as well as I cannot look inside your mouth and test for your gag reflex and make sure your tonsils are movable. By doing that, I would have you swallow something and say ah while sticking a pad in your tongue and like holding it down. And I would also assess your gums, your tongue, your hard and soft palate, make sure there's no any lesions or anything like that. But because of the mask, we're not doing that today.
Okay.
And now I'm going to assess your ears.
Okay.
I'm gonna don gloves. Okay, and to start, I'm just going to palpate your auricle and your tragus and your mastoid. And there's no pain?
No.
No? Perfect. Okay. Now I'm going to use the otoscope and I'm going to look in your ears, make sure there's no drainage, and make sure that everything's appropriate color and appears right. Attach one of these. Pull up and back. Okay, and it looks pearly and gray, no drainage. That's good. So I'm going to turn your head to the side to do it this side. Okay, and again, it's appropriate color. Oops. No obvious drainage or anything. Discard these. Perform hand hygiene. Okay. And I'm going to walk around you and I'm going to perform what is called a whisper test. So I'm going to have you press on your tragus, like keep pressing it on and off. And I'm going to whisper 3 words and I'm going to have you repeat them back to me, okay?
Okay.
Okay, so have you start pressing on them?
Tree. Ear. Finger.
Okay. And the other side?
Okay. Car. Phone. Pen.
Perfect. And that is cranial nerve number 8, and that is intact.
Okay.
Which is good. And now I'm assessing your trachea, and upon inspection, it looks midline to me. Now I'm just going to palpate it, and it is midline, no tenderness, masses, or anything like that. And I would test your thyroid gland by pushing your trachea to the side on both sides, using a posterior and anterior approach. While doing that, I would have you sip water, and I would feel your thyroid to make sure that it was moving up as you sipped or so as you swallowed the water. But because of COVID and the masks, we're not going to do that today.
Okay.
Okay. And now I'm going to have you turn that way because I'm going to listen to your lungs.
Okay.
And upon inspection, it looks like you have no difficulty breathing. And yeah. So I'm just going to auscultate in 10 to 20 spots. And I would usually listen for 1 whole respiratory cycle, but I'm just going to show placement for the video. I'm just gonna have you turn back this way,
Okay.
and I'm going to listen in the front.
Okay.
You move your arms just like
Oh, sorry. Yes.
Okay, perfect. Your lungs are clear and there's no wheezing, bronchi, or any crackles.
Okay.
Okay, and now I'm going to inspect your chest, and upon inspection, it is symmetrical. There's no obvious masses or lesions. And now I'm going to palpate for any thrills, lifts, or heaves. And I do not feel any, which is good. Okay, and I'm going to listen to your heart now in 4 different places. And I'm going to use my bell and diaphragm. I'm just listening for S1, S2 sounds, which is your normal rhythm of your heart. And I would normally listen for 25 to 30 seconds, but I'm just going to show placement for the video. This is your aortic, pulmonic, tricuspid, and mitral.
Sorry.
Okay, and then again with my bell. So aortic, pulmonic, tricuspid, and mitral. Okay, perfect. Don't hear any abnormal rhythms. I hear the S1 and S2, which is perfect. And now I'm going to assess your external extremities. And this is just to make sure that you have perfusion going to both your legs and your feet, and that they're appropriate, which is 2 plus bounding.
Okay.
And at the same time, I'm assessing your skin and make sure it's warm, dry, intact, no bruises, moles, or anything like that, which I've also been doing the whole assessment.
Okay.
Okay, so I'm going to check your pulses first. Your brachial, radius. Okay, I'm going to do your femoral, popliteal, and dorsi, and your pedal pulses. Okay, perfect. All pulses are 2 plus bounding, and which means that you have good perfusion throughout your body. And I'm just gonna check your capillary refills. And upon this, I'm just checking how quick it fills up, and it's less than 3 seconds, which is good. Okay, and now I'm going to have you lay down, and I'm going to do an abdominal assessment.
Okay.
And I'm gonna pull this out so you have a feet rest.
Okay.
Okay, there you go. So normally I would have you raise your shirt, and I would inspect for the contour, which it looks flat right now, and any masses or lesions, but for the video I'm just gonna have you leave your shirt down. Okay, and I'm going to listen in all 4 quadrants in 3 to 4 different spots, and I'm just listening for active bowel sounds or any abnormal sounds.
Okay.
Okay, perfect. I heard active bowel sounds in all 4 quadrants.
Okay.
And now I'm going to percuss in each quadrant, just making sure, or just checking organ placement and making sure that the appropriate sound, that there's no inflammation. And now I'm going to do a light palpation and just let me know if you have any pain. I'm just looking for organ placement or any tenderness, okay?
Okay.
Okay, no pain?
No pain.
Okay, perfect. So I did not feel any inflammation or organs out of place, which is good. And now I'm just going to have you sit back up and face the camera.
Okay.
I'm going to perform a musculoskeletal assessment now. And while doing this, I'm going to check your joints and range of motion and the strength on each and some of your tendons and muscles, okay?
Okay.
Okay, so to start, I'm just going to start by feeling all of your joints and make sure that there's no tenderness or anything. So I'm going to start with your TMJ, your cervical, shoulders, elbows, wrists, hands and fingers. No pain or anything?
No pain.
No. Okay. And your hips, knees, ankles, and feet and toes. Okay, good. And so I'm going to check your sensory in your hands and feet. So I'm going to have you close your eyes and I'm going to have you tell me whether you feel something sharp or dull, okay?
Okay.
Hands. We're gonna do this on both hands.
Sharp.
Okay.
Sharp. Dull. Dull.
Okay. And now your feet.
Sharp. Sharp. Dull. Dull.
Perfect. So now I'm going to check cranial nerve number 11, which is your cervical. So I'm going to have you look down, look up, look right, and look left. Any pain?
No.
Perfect. You have full range of motion now. And now I'm going to check your range of motion in your shoulders.
Okay.
Okay, so can you shrug for me? Okay, and pull your shoulders forward, backwards, and then raise your arms to the side like this. Okay, perfect. Any pain?
No.
Perfect. Okay, move it down. And we're gonna do the same thing, but I'm just gonna have you shrug against pressure.
Okay.
Okay, perfect. And I'm gonna do the same cervical test, but against pressure to see if you have appropriate strength.
Okay.
Just push against this way and this way. Perfect. So you have perfect strength and range of motion in your cervical joint and your shoulders. Okay. And I'm just gonna have you lay down one more time. I'm gonna check your range of motion and strength in your hips and your knees.
Okay.
Okay. So we're just gonna do the range of motion first. So I'm gonna have you lay your legs flat, and then can you raise one leg at a time, bending? Yep. Like that. Mhm. And then I'm gonna have you take your left leg and bend it outwards. Yep. And then inwards. Okay. And then same thing with the other leg. Out and in. Okay. And we're gonna do the same thing but against pressure, okay? But I'm gonna go on that side of the table. So raise your leg against pressure. Okay. And then put your leg up and then down. Okay. And then out towards pressure. And in. Perfect. And then up, and then down, out, and in. Perfect. So your full range of motion and strength in your hip joints. Okay. And for your knees, I'm gonna have you bend your knee and bring it forward. Okay. And then back down. And then I'm gonna have you raise it against pressure. And then against pressure down. Okay. And the same thing over here. Up. And then down. Okay. So you have full range of motion and strength in your knees as well. And now I'm going to have you sit up again, and I'm going to test two deep tendon reflexes. So if you just want to face this way. Okay. So I'm going to check your bicep reflexes. So I'm going to have you just straighten your arm and like let it relax. Now pull down. Okay. And this side. Down. Okay, perfect. That reflex is intact. And I'm gonna be like dangle your knees, and I'm gonna do your patellar reflex. Okay. And then this one.
Come here.
Okay, perfect. And I believe that completes my assessment. So do you have any questions?
No.
No? Okay, perfect. Thank you.
Thank you.